an area of interest. In the meantime, there is a pitching session that has been running where 6 innovative UK businesses in the healthcare sector are pitching their businesses, and equally 6 European businesses are sharing their pitches on their own innovations with the aim to foster collaboration opportunities. There will be a virtual B2B session that's following the session that we're running now. But what we're going to do, without further ado, is to introduce you to Neil Toner. He is the workstream lead for enterprise and innovation, and we're very, very happy that he agreed to have a presentation on the introduction to the Health Innovation Yorkshire and Humber and how they support innovators. This presentation will be followed by a very brief presentation on Innovate UK Business Growth Support and how we work with the Enterprise Europe Network, and then you will also have some time for questions at the end. So I can make an introduction to Neil. Neil, if you would be happy to share your screen and walk us through your wonderful presentation.
Sure, no problem. We'll share my screen. Just let me know when you can see that.
We can see that.
Great stuff. Okay. Hi everyone. Yeah, I'm Neil Toner. I'm a workstream lead here at Health Innovation Yorkshire and Humber. So I'm speaking to you from Leeds in Yorkshire, but our organisation covers the whole of Yorkshire and Humber. So this really is just an overview of the kind of work we do, how we support innovators, both UK-based and international, and how we collaborate with the system here, the NHS in the region, to support their needs. So a little bit of background, move on to the next slide, about the Health Innovation Network itself. So there are 15 different networks across the whole of England, one for each region, and a few in London. They were set up about 15 years ago by NHS England to be the kind of key innovation arm of the NHS. So each of us carry out a very similar types of activity, but tied very much to the needs of the system. So you will get a similar sort of level of service and interaction with companies, but it will be very much based on the needs of their locality and how they do things in that particular region. So that you can see us towards the top of the image there, in the kind of center of the map. We've got 3 goals, 3 key goals as a health innovation network, and that's to improve the health of patients in our region, to drive economic growth, and also to try and drive efficiencies by saving money in health and care. So we hold that very dear to our hearts, and in everything we're doing, interacting with companies, with SMEs and industry, and with the NHS, we're always looking for those opportunities to use innovation to support our patients and help growth within the region. A little bit about some of the impacts that our work has had, because we measure the work we do so that we can report back to our commissioners on the kind of strength of the value we provide to our region. So some of that work in terms of working with companies, we've actually helped to 34 jobs to be created and 42 to be safeguarded by the companies that we've worked with. In our whole organisation, nearly £60 million worth of investment has been brought in through work and projects and programmes that we supported in our region, and £10 million worth of that has been investment into SMEs that we've worked with through either grants, other funding sources, and also investment as well. And there's also the activity that we do with the NHS as well. Over 29,000 patients benefited from our programmes in the region, and we also measure our kind of net zero impact as well, and the savings that we've done around CO2 emissions as well. A brief overview of how our organisation's kind of split up. We've got the Enterprise Innovation team, which is the team I'm in, very much focused on outward-facing engagement with industry and trying to work with the NHS to create spread and adoption of new technologies, and also trying to understand the regional needs of our system so that we can demand signal out to industry to share that with innovators about the needs of the system, the priorities, and how they as innovators can help support our system in the best way possible. We also have innovation hubs that are based within each of our localities in West Yorkshire, North Yorkshire and South Yorkshire. And they work much more closely on the ground with the system to deliver projects and work on programs with the NHS. And then we've got a really large delivery arm who are working on projects implementing change. So some examples there are virtual wards that were rolled out over the last few years. We're working on lots of workforce programs with our stakeholders, and also some remote monitoring as well as several others around mental health, health inequalities, and other areas as well. The region we represent, just to give you some insight, there's 5.5 million people in the whole of Yorkshire. There's over £12 million worth of investment just into healthcare. So it's a large system here with, as I said, 3 integrated care systems, over 20 acute hospitals, several of which are very large teaching hospitals. And where I'm based in Leeds, we work very closely with Leeds Teaching Hospital Trust, which is an internationally recognised hospital system here. And lots of primary care practices as well as care homes. And over 600 life science companies are based in the Yorkshire region as well. We don't do all this work on our own. We acknowledge all the kind of key assets that we have in our region, and we're very lucky to have some really great centres of excellence. We have the Health Innovation Campus being built at Huddersfield University. We have several accelerator programmes. We have a local authority who are very invested in life sciences as a sector. And we also have the funders who actually support us, one of which is Innovate UK, who are supporting this programme, and also SBRI, NIHR, and also Macmillan Cancer Charity, who's funded programmes in our region. An overview of the kind of support we provide SMEs, because that's hopefully the bit that you're interested in, and that is that as part of our commission service, we offer a kind of basic level of support for all SMEs, and you're able to register with us as an organisation and have a triage call with one of our team members to understand where you're at in terms of your solution, what your needs might be in terms of engagement with the UK, what information you're trying to understand. You're trying to get a better insight into competitors. Are you aware of the kind of operational guidance and long-term planning that the NHS has in your particular field? We can start to give you some feedback around your value proposition. And then for companies that are more mature, then there's more sort of advanced work that we're able to offer around that kind of more in-depth support, where we might do a bit more development with them, co-development with them around their value proposition. Could be that they've got a project in our region, and we do have a small funding pot for evaluation of those projects so that they can measure the outcomes, both in terms of return on investment, but also the patient outcomes as well. And there may be a funding bid that they qualify for, that we're able to co-write or collaborate on to deliver a project within the region. So the support really is needs based and really depends on the innovator themselves. And we speak to everyone from spin outs out of university all the way through to large pharmaceutical companies and large corporate organisations who are working on projects in healthcare in our region or wanting to. And we can kind of act as an honest broker to them. We also run a international program called Propel Bootcamp. So this is part of our wider Propel program that we run for UK-based companies. So that's been running now for 6 years, and that's a 6-month accelerator program for digital health and medtech companies. We've now over the last few years, we've created an international version where we have a 7-day program of activity, workshops and networking for cohorts of companies from outside the UK. So we've run that with a US cohort, 2 Canadian cohorts, 2 Nordic cohorts, sorry. And we're hoping to run another one next year with a group of 10 Nordic companies too. So the structure of the course is a series of masterclasses that cover these key themes around growth and spread, sustainability, legal and governance, funding and finance, and evidence generation.
Sorry, just an interruption. Matthew, could you please press the mute button because we're getting some noise? Thank you. Sorry, Neil, continue.
No worries, thank you. So this is a series of masterclasses that are run, and also we have a networking session where the companies on that program are able to present to a series of different stakeholders, both from health research, from NHS, from academia, and from the private sector, to pitch their solutions and then find partnerships and opportunities to discuss solutions further. So, as I said, we've run that program with several different territories. It's usually partnered with a governmental organisation or an accelerator program in the territory itself. Hence that we've always done it with a particular area. So the Nordic program was funded by a governmental organisation called Nordic Innovation. The Canadian government funded their program. So we're always looking for new opportunities to build out on that program and run it with different cohorts. So we'll be exploring that again in 2025. So I think that. Oh yeah. So some of the international partners that we've worked with. Every year we engage with around about 200 companies each year, both from events like today, webinars, delegation visits to both London and Leeds that we attend, and the bootcamp programs that we run as well. And we've engaged quite heavily with all these countries here, both from Norway and the wider Nordics, India, Canada, Estonia. There was a delegation that came over last year from Estonia, Germany and Israel as well. So I think that brings me to the end of the overview. It's kind of a whistle-stop tour of our activity, how we work with the system within Yorkshire, but also how we work with innovators, both UK-based and internationally. And our services, those basic services, are free of charge. We're happy to have a triage call with companies who are looking for a better understanding of how they might enter the UK. In general, it's worth saying that our focus is more around digital, some devices, and that side of things, rather than biotech and pharma, which has obviously got a very clear regulatory pathway into the market. But we're always interested and keen to speak to new innovators who are looking to enter the UK. So thank you for listening. I hope that's been useful. If you would like to speak to us, there's a link to our registration form on our website and my email address as well down the bottom there. And I hope that's been interesting for you. Thank you very much. I'll stop sharing.
Thank you so much, Neil. That was very interesting. There's a question whether you could drop the registration form in the chat if that's not too much trouble. And certainly. I'm wondering, yeah, thank you. And I'm wondering whether there are any questions for Neil.
Yes, hello. I have a question for Neil. Thank you, Neil. That was really useful. Yes, so we're actually a UK health tech company. Mm-hmm. We're a UK Class 1 medical device and an EU Class 1 medical device because we're working on a number of contracts in Europe. Mm-hmm. We joined today because we'd be interested to find out whether there's an offer for you helping us reach more European countries. And I wondered from your presentation whether your offer is more for overseas companies who are trying to establish in the UK, or whether you do the other bit too, which is helping companies explore the European market specifically.
Yeah. So we haven't done I guess export is what you're talking about, aren't we? We haven't done a lot of export activity, a huge amount, because we're focused on supporting the needs of our local system. However, however, what I would say, so I would say that our strength does not lie there. However, we have done some outreach programs to the likes of Arab Health alongside the ABHI.
Yeah.
So members of our team have gone out on delegations to both Arab Health, and also ABHI run a US program, accelerator program, that we're a partner on, and we work to sometimes recruit companies as part of visits to different health systems across the US. Just this year, we did run a program with Nordic Innovation called Nordic Proof, where we work to recruit UK companies who are interested to engage with the Nordic system. And basically, that's a program where Nordic Proof have recruited a series of health systems across the 5 Nordic countries who are interested in collaborating with international companies on pilot projects and proof of concept. And this program basically kind of sort of matches you up with the right healthcare system, and then you get to have a follow-up conversation with them to talk about how your project might be able to land in their system. So if the Nordics is interesting to you, then I'd be happy to have a catch-up call another time, just to give you a bit more insight into that program and share some details. So I'd say it's not our strength, but we are moving into that space a little bit more over time.
Yeah, thank you, Neil. I'll take you up on that. So shall I just follow up with Ashley on to get your details with that?
Yeah, I can put my email in the chat as well.
Lovely,
you can
thank
just
you.
click on the email. I'll do that in a second.
Thank you.
No problem.
Thank you, Neil. Thank you, Julia. Any other questions?
Can I just ask about? I came late to the meeting because of the other presentations. Neil, had you started sometime before the other components had left? So I think I might have missed sort of some of the broader. I certainly missed the beginning of your presentation there. I mean, it's very good to see it. So I think from the international point, I think, Neil, that we might be able to support, and just going back to Julia's one, the sort of the cooperation between Innovate UK and yourselves, and possibly with other agencies as well. So the balance of insight and projects and meetings such as this, Julia, we might be able to support you with international developments as well. It's really good.
Thank you, Marcus. Yeah, I used to work with you, Marcus, actually. I don't know whether you...
Yeah, no, I recognise that.
Yeah, because we've got a few contracts that we're at terms with in Europe, and we've also at terms with another buyer in the States. So be interested in the States Accelerator Programme, and Nordic sounds like a really good fit for us because we're a Class 1 UK medical device. So I'd be really delighted to follow up if you can help.
Yeah, I mean, it's definitely the case that the health innovation networks have tremendous insight and experience there, which was really pleased to see Neil on the presentation here. It's I think from the point of view of Neil of actually helping international people come into the UK. I mean, some of the challenges that I hoped you might be talking about is how we identify and differentiate and maybe enhance those areas where we recognise within the UK that there are particular unmet needs, and the potential for promoting those or assisting those, as opposed to those that are coming in as, say, as commodity items. That there is being progress in, and how the UK is looking to address healthcare challenges, and how the health innovation networks are responding to that by, in some respects, improving both innovation from within the UK and adopting innovation from other parts of the world. And that's a sort of a big topic there, but just there is some progress being made, isn't there? Sort of encourage us that we want to work with international parties.
Certainly, we're very open to that, looking outward, being outward facing, and also, part of our role is to try and simplify the complexity of the system here, which from the outside, even within the UK, can be hard to navigate if you're a UK-based company. And part of our role sometimes with international companies is just being able to provide them with some of that kind of foundation level information that allows them to make a bit more of an insightful decision on how they enter the UK, because the UK is seen as a big market, the NHS is seen as a huge provider. However, the kind of the complexity within that system means that you do have to make a seriously considered decision about how you're going to sort of approach the system here, because the NHS isn't a single body. You don't go and knock on their door and someone answers to discuss your product. So it is about building up that kind of credibility almost in terms of your value proposition to be able to speak the right language, and by that I mean the kind of NHS language, to understand their needs properly, to understand how you fit within their pathway, and that's what our triage call is about understanding where you're at in terms of maturity and how we can start to, I guess, educate you as innovators to make the right decision, because it's a huge investment, you know, trying to engage with the UK. So we want people to make that with a clear understanding of how they might go about that.
Great. Thank you very much, Neil and Marcus. Any other questions? No, before we move to the second part of the session, which will be an introduction into the Innovative UK Business Growth Offer, which many of you might have already known, but just a more increased focus on how we work with the Enterprise Europe Network to support businesses in their internationalization journey. So I will share my screen, and you can let me know if you can see it. Just a second. Can you see my screen?
No.
Not yet. Let me try it again. It should work now.
Yep. Yes.
Yep. Perfect. So I will just quickly run you through the Innovative UK Business Growth Offer, and essentially to mention that this is the government's innovation agency's resource for innovative businesses that are looking to grow and scale. So Innovative UK Business Growth is helping businesses achieve their ambitions through targeted bespoke support from the core of our offer, which are the innovation and growth specialists. What they do is work one-to-one bespoke with the businesses to assess their needs and identify challenges to their growth by creating an action plan that can help them tackle these challenges and pursue certain opportunities. The wraparound support that we offer as Innovative UK Business Growth is for innovative businesses that are interested in exploring any of the three areas that you can see in the screen. So our support is very much tailored to these needs, but these needs might fall under these three categories. The first one might be innovation management. So a business might need help with developing their business model, securing their IP. Another area could be investment readiness support. So a business might like to explore grant funding options or even pursuing private investment. And finally, the area that we will talk a bit more about today is expanding in international markets. So how our innovation and growth specialists can help a business enter new markets, find collaborators, and also get some market intelligence that will help them understand whether the market is a good fit for them. With regards to international markets, I will just quickly mention that the access to the partnering opportunities around the world through the Enterprise Europe Network is one of the key resources, and I will explain how we work with the Enterprise Europe Network in a second. We are very well embedded in global markets through the Enterprise Europe Network directory, allowing the innovation growth specialists to make targeted referrals to their counterparts, so advisors in key markets that the businesses are interested in expanding to. We do have some flagship programs that work in work together with our wraparound support. So when a business is enrolled in the internationalization support, it might be a good option for them to explore the Global Business Innovation Program, the Global Incubator Program, as well as the Global Explorers Program, which is currently paused but will renew again. We do also offer access to focus brokerage events for new international business innovation opportunities, and also provide regulatory information as well as advice and support on Eureka and Horizon Europe access through also our Horizon Europe pump priming initiative. How we work with the Enterprise Europe Network, I will explain very, very briefly that EEN, Enterprise Europe Network, is fully embedded in our growth and scaling service for innovation-led businesses. So our innovation and growth specialists, when they work together with a business that is interested in expanding internationally, have a range of resources, contacts, and tools that they can use through our partnership with the Enterprise Europe Network. So we have access to the Partnering Opportunities database, which advertises profiles of businesses all around the world. There are currently more than 5,000 profiles that an innovation and growth specialist can help an innovative business here in the UK identify, and even help a UK business create one profile to be published in that database. In the Enterprise Europe Network, we also operate with certain sector groups that are focused in particular areas. In fact, today's event is facilitated with members of the health sector group with Enterprise Europe Network. They're specialists that are experts in the area, because overall the support that we offer as Innovate UK Business Growth is sector agnostic. But obviously, when we support a client that is interested in a particular area, Enterprise Europe Network's sector groups really help with identifying key opportunities in key markets of interest. Through the network directory that we have with Enterprise Europe Network advisors, that means that we can have targeted discussions between the UK and the EU single market when it comes to collaboration inquiries, when it comes to market regulation inquiries, which are also facilitated through our National Inquiry Gateway service. That it's the first stop for an innovative business that enters the Innovate UK Business Growth website and is looking for support with a particular query that they may have. Finally, we're engaging with the sector group workspaces also for co-organizing brokerage events like the one that we are facilitating now in Desire. So overall, there is a very there's a very pronounced appetite for working with the EU, and our partnership with the Enterprise Europe Network further demonstrates that we can still we still have a gateway to the EU through Innovate UK Business Growth, and we can help UK businesses to explore that market further through the many resources, contacts, and tools that I have mentioned. This was a very brief overview, and I will stop sharing my screen now in case there are any questions that you might like to ask. Thank you.
Thanks, Angelina. Just very quickly, would you mind dropping the partnership database link in the chat?
Of course, yes, I can absolutely do that.
Thank you.
Any other questions? I just shared the link in the chat. I don't want to keep you too much from your B2B virtual session, which is the next session in the event, that you would also have had the chance to arrange meetings beforehand, but also you will have visibility of the participants so that you can facilitate any discussions that you think might be interesting in this virtual B2B space. Any other questions for Neil or for me, or any comments before we end this session right on time?
I would just add in that partnering database has several perspectives to it. One is, it is a very substantial database of people that would like to work with us, would like to work with you. So it's certainly one to look at. and look at the different opportunities, technological and business and research, especially on the research side around raising Horizon funding or applying for European grants and so on. So, and then there are facilities both in the UK and in the European countries to have a profile written on your behalf and put into that database. And so there's this sort of ways of finding people and also presenting your case. And a critical part of that then is, as much as it being a database, there are people like myself and Angelina and our colleague Karin and Lisa from Austria, facilitating the conversations and partnering with us, bringing us all together. So I think it's both technology and people that is there to make these resources successful. So I've really enjoyed today as a sample of what we're doing, and it's a small step, I think, but a very significant one in bringing the UK and parties, companies and agencies together with international parties and agencies as well. So Angelina, thank you very much. And Neil as well for your time today. It's really appreciated.
Pleasure.
Thank you, Marcus.
Yeah,
thank you,
thank you.
Neil.
No problem.
Angelina, can I just add to that, just to say that there's another area, I'll drop it in the chat as well, as part of the EEN process as well. There's some sort of services out there like pump priming, for argument's sake, but we've also got an EU tenders and funding portal where you can search for opportunities and tenders that are currently open and available or upcoming. So if it's okay, I'll drop that in the chat if I can work out how to do that.
Thank you, Nick.
It's different process that I'm used to. But yeah, again, if you can liaise with your innovation and growth specialist on that anyway, but there'll be some good opportunities to view things on there. So sorry, thank you. Just want to put that in.
Thank you.
Perfect. If there aren't any other questions, I would just like to thank Neil Turner again for his wonderful presentation. Thank you everyone for your attendance. Thank you Marcus and Nick for supporting this event from the Innovate UK Business Growth side. And we will see you all virtually in the B2B or in any future events. Any questions you may have, please don't hesitate to reach out. And thank you again so much for your time.
Thank you.
Thank you.
Thank you.
Thank you all.
Bye.
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 Bye.